maybe after taking just one tablet, the person feels nauseated already, he wants to vomit. You now prescribe a we just prescribe a drug for maybe like 10 tablets morning and night. Most likely the patient will not comply. And if the patient ends up vomiting the drug, he will not get the therapy prescribed. So imagine taking maybe Lockmal 4 BD, you take another amoxicillin 1 gram BD, you take prednisolone 10 milligram, that's 2 tablets BD. At the end of the day, it's a lot. So as much as possible, you try to use more of fixed dose combinations, the ones that have already been combined into one. Going forward, safety. In terms of safety, think of the side effects of the drug and then the patient status. There's no point giving an ulcer patient an end stage. The first one has acute ulcer because you won't like a situation where the patient will come, he came to the hospital complaining of joint pain and then you end up giving him stomach pain as he's going back home. It's not going to give you a good review, but it's not going to be a good review for the hospital. Then also you think of the issue of side effects. It would be nice when the patient is taking the drug and cannot continue the drug because of the kind of side effects it's feeling. For example, the piperaquine molecule, that's one in P-alaxin and Remal. Most people come down with it. Once they start taking it, some people cannot even finish it. So the best advice to give such a patient is to use it at night when he's about to sleep. So by the time he wakes up in the morning, he's fresh again. He won't even know that he took something. Then for efficacy, two things come to play. There's the issue of quality, which we already have taken care of. We source quality drugs from the best companies and at the best prices. Then the second part is something we call therapeutic margin. The therapeutic margin actually refers to the concentration of the drug in the body. At this margin, the drug is considered to be, when the concentration of the drug falls within this margin, it's considered to be very effective. Above this margin is considered to be toxic or lethal. And below the margins, the dose is considered to be too low to be effective. Now, we also have the thought of no untreated irritation. We've had instances where, while dispensing to the patient will ask, what did the doctor prescribe for this cough? What did he prescribe for the body itching? And then you go back to the doctor and then you ask, there's no drug for itching there's no this, and then you find out that the doctor actually meant to write it, but for some reason he omitted it. So such questions sometimes actually matter. It's good to just ask questions that they're dispensing, not just give the patient the drug. So at the end of the day, if it doesn't get a relief, you still blame the doctor that this one doesn't know work. And then another situation is that you also, anytime you see a prescription that is not really the normal things, we have to always also ask for clarification. There was a time we were told to give a patient normal saline, put a few drops in water, and patient used to have his bath. So we're now thinking like, this is a new one. We are going to go back and research it. We need to find out what this is all about. But then we went back to ask the doctor, and then we just found out that the doctor was actually thinking of Savlon. What happened that he was attending to an emergency, so what was in his head was normal saline. So he ended up writing normal saline for the patient. So imagine that kind of. Then, talking about mixing injections. I know it's a common practice to mix different injections in the same syringe. You're trying to reduce the cost, you're trying to reduce the piercing. But most times it's better to play safe. Most pharmaceutical companies, they don't even produce this kind of combination because they know that they are physically and chemically unstable. For instance, now this is a real life scenario that I witnessed. The patient had a hole in his bum bum thanks to injection that the nurse did not want to divulge to us what she gave. We were just trying to blame it on something else. And then at the end of the day, she was trying to use the salt to clean the wound. The patient was not comfortable. He was already agitating and all. So it's better to play safe and not mix any injection you don't really know the reaction that will occur. And it's not every reaction that occurs with a color change. Not everyone comes with an evolution of gas. Not everyone comes with a precipitation. Not everyone comes with the syringe getting hotter. There are some that are just purely ionic. You won't know what happened, but the two drugs that you mix together have actually been denatured. They're not going to be effective, or one or both drugs may even be denatured. So best you just give per time as needed. Okay, in summary, I say carrying out medication reviews as you dispense drugs is actually what I consider good clinical practice. In doing that, you you help everyone to move towards the desired goal of getting the best medication, get the desired therapeutical outcome, and reducing side effects. Also, it reminds us of the importance of the right drugs for the right patient by using the right dose at the right time through the right rate. Thank you.
So we say thank you to our presenters for